Hello, and thank you for joining me. Welcome to the wonderful world of fiber reinforcement in dentistry using the glassband fiber reinforcement system. I developed the glassband system in response to the profession's need to reinforce composite resin structures in dentistry. Traditionally, our composite resins lack the tensile and flexural strengths required for certain clinical procedures such as splints and orthodontic retainers. The purpose of our videotape today is to better acquaint you with the uniqueness of the glassband flexible ceramic system and how it's going to make everyday clinical practice easier for you. The glassband system is quite different from all other fiber reinforcement systems. It's easy to use, it's thin, it easily adapts within the mouth. It requires no special gloves, no special scissors. The material itself is user-friendly, it's doctor-friendly, it can be easily applied. The patients will find tremendous satisfaction out of the restorations you'll create for them. You're going to find that without any special training other than this videotape, you'll be able to start immediately using the glassband system in your practice. Because glassband is a ceramic material, it doesn't exhibit any dimensional changes as some of the plastic reinforcement systems. And I think you'll find that over a long period of time, it presents a more reliable, more predictable, more dimensionally stable, and therefore fracture-resistant type of restoration. I've spent a lot of time developing this system. We've spent a lot of time making sure it's a reliable system, and I think you're going to enjoy using it in your practice.
The glassband ceramic bonding system offers dramatically improved dental techniques for anterior and posterior periodontal splinting, post-orthodontic retention, stabilization of reimplanted or injured teeth through the fabrication of an emergency trauma splint, provisional implant bridge reinforcement, immediate replacement of lost or missing teeth, and fabrication of the glassband bridge. After publishing his first paper about glassband in 1992, numerous articles by world-renowned clinicians appeared describing glassband as the fiber reinforcement system of choice, with 9 out of 10 dentists preferring glassband to any other system.
Glassband, in a sense, has revolutionized dentistry by eliminating the need for wire or metal for composite reinforcement. Dr. Jonathan Scharf's contribution to the dental profession has been beneficial indeed. It's great to have an ideal fiber reinforcement that's advantageous both aesthetically and functionally.
I've seen bridges placed with it. I've seen teeth splinted with it. I think it's a great product.
It's very easy, very simple.
Glassband is definitely the future in dentistry.
There's no question about it that glassband offers the simplest, the most aesthetic, and the most cost-effective method of replacing metal reinforcement in any of the dental restorations that you're going to be seeing in this video.
Each kit contains 12 flexible strength members in 4 braided and woven configurations. There is the woven tape for extracoronal anterior post-orthodontic or periodontal splinting, which may also be used as a matrix for immediate pontics. There is a small braided rope for intra or extracoronal splinting, emergency stabilization, or flexible attachments for bonded bridge work. There is a medium braided rope for intracoronal anterior and posterior periodontal splinting or emergency stabilization. And there is the large braided rope for intracoronal posterior periodontal splinting. Each kit contains a total of 42 inches of material sufficient for up to 20 clinical applications. Also included in the kit is an illustrated manual, as well as technical updates with detailed instructions for several chairside and laboratory procedures. Cutting glassband is quite simple. There are no special handling techniques and it requires no special scissors. Notice that the ends of glassband ropes and tapes are protected with a plastic end bead. This prevents unraveling of the special weave prior to intraoral use. This must be removed prior to the clinical placement of glassband. When you're ready to use glassband, carefully remove it from its glass vial. There are no special gloves required for the handling of the material. Never cut glassband material until you have followed these steps. Place a small amount of clear bonding resin next to the binder on one end, coating approximately 1 or 2 millimeters of the glassband. Light cure the resin. Remember, unlike other fiber reinforcement systems, you don't need any special scissors to cut the glass span. After curing, cut through the glass span at the point where you've placed the resin with any pair of sharp scissors. When you follow these simple cutting steps, the glass span will not fray. Measure the amount of glass span you will need for your particular clinical application. Place a small amount of clear bonding resin, again coating about 2 or 3 millimeters of the glass span at the spot determined by the measurement. Light cure and cut through the cured resin with your sharp scissors. You now have your glass span cut to the proper working length with no frayed ends. Now it's time to go through the procedures. Before glass span, post-orthodontic retainers or periodontal splinting involved extensive wire ligation, which was not only unaesthetic but time-consuming as well. This new technique offers many advantages, including a more comfortable, more aesthetic treatment. Carefully remove the old bonded retainer. Complete debridement should also include pumicing the teeth to receive the glass span and cleaning interproximally utilizing medium-grade abrasive strips. Before placement of resin on the tooth surfaces, measure and cut the desired amount of glass span tape as previously described. Be sure to confirm the length prior to placement of resin on tooth surfaces. The glass span tape is now coated with a clear bonding resin, followed by a porcelain veneer luting cement or flowable hybrid composite resin. This surface treatment of the glass span is common to all of the clinical applications demonstrated. Leave the resin uncured at this time and protect the treated glass span from light exposure until ready for placement. Wedges should be placed interproximally to prevent excess resin from flowing into embrasure spaces. Condition the lingual and interproximal surfaces with phosphoric acid etchant for 15 to 20 seconds. Then thoroughly flush with water. Apply a dental adhesive or clear bonding resin. Cure with the polymerization light. Place a thin roll of hybrid composite resin approximately 3/4 to 1 millimeter in diameter and compress it flat against the tooth surfaces already treated with the adhesive or clear bond. Do not cure. Lay the treated glass span material flat against the soft bed of composite resin and position it at the level of the contacts. Compress the glass span into the composite, leaving it slightly taut. Cure with the polymerization light. This step greatly simplifies the placement and positioning of glass span. A second roll of hybrid composite resin is now placed over the glass span material and compressed flat. This may be accomplished with a gloved finger covered with clear bonding resin. Cure with the polymerization light. When properly applied, these layers of composite are ultra-thin and do not create overbulking of the final restoration. After removal of the wedges, use a combination of diamonds, fluted carbides, and composite polishing paste to smooth and polish the splint to provide acceptable final contours. The patient should be instructed in the use of floss threaders to maintain proper oral hygiene of the retainer. As you can see, the final restoration is not only easy to fabricate, but it is aesthetic, strong, and it provides a high level of patient satisfaction. Glass span offers a simplified method of periodontal splinting for periodontists and restorative dentists who need to stabilize mobile teeth such as these. Create a channel wide enough for the glass span rope and restorative resin, mesiodistally along the occlusal surfaces of the teeth to be splinted. The depth and width of the channel should create a cross-sectional surface area approximately 4 times that of the piece of glass span rope selected. This assures adequate room for the hybrid composite resin, which, together with the glass span, provides a fracture-resistant splint. For this periodontal splint, you'll need a small or medium glass span rope. Before chemical preparation of the tooth surfaces or placement of resin into the channel, measure the length of glass span required for the splint. The procedure for cutting glass span rope is the same as for cutting glass span tape material. First, place a small amount of clear bonding resin on the glass span. Cure it with the polymerization light. Cut through the bead of cured resin with any pair of sharp scissors. This leaves a clean, unfrayed working end. Confirm that the length of glass span cut properly fits into the channel. The glass span rope may be coated with a clear bonding resin followed by a porcelain veneer luting cement or flowable hybrid composite resin as previously described. As an alternative, the flowable hybrid composite resin may be injected into the glass span rope for extra strength using a needle tip syringe. Regardless of the method you choose, you must always coat the external surface of the glass span rope. The internal surfaces of the channel are etched for 15 to 20 seconds with phosphoric acid and thoroughly flushed with water. After placement of a universal dental adhesive, the internal surfaces of the channel are coated with a thin layer of clear, unfilled resin and polymerized with a curing light. Place a thin layer of posterior hybrid composite onto the floor of the channel. Seat the glass span rope into the soft bed of hybrid composite, positioning it far enough into the channel so that it clears the occlusal surfaces of the teeth being splinted. Polymerize with a curing light. Additional layers of the posterior composite resin are incrementally placed and cured until the channel is slightly overfilled. Using fluted carbides, the splint is contoured and the occlusion is adjusted. Finishing and polishing is now completed. Check the margins to make sure that they are smooth. Confirm that the embrasure spaces are open so that the splint will be easy for the patient to clean. The glass span splint, fabricated more simply and quickly than metal-supported alternatives, is predictably strong and highly aesthetic.
The ease of use of the glass span tape in comparison to the alternative product out there is far superior. We're able to manipulate this material in such a way that we can keep it very thin within the wings of this bridge and still gain strength.
The indirect glass span bridge, fabricated from simple alginate impressions, allows for faster and easier replacement of missing teeth with no unsightly metal. Be sure to take a counter impression, bite registration, and shade. The following procedures can be accomplished in the laboratory. After mounting and articulating the models, mark the location of the glass span attachments with a pencil. The abutment teeth are prepared on the model to accept a continuous piece of glass span rope. This is usually a horseshoe-shaped channel. Place the glass span rope into the preparations. Tack the ends together in the pontic area with a clear bonding resin followed by a porcelain veneer luting cement or flowable hybrid composite resin and light cure. Cut away the excess ends of the glass span. The portion of the glass span to receive the pontic is also treated with the previously mentioned resins and light cured. The pontics may be constructed using any of the available posterior hybrid composite resins. Incrementally build and sculpt the composite resin, curing each layer until proper anatomical contours have been achieved. The flexible glass span attachments, which extend beyond the pontics, remain untreated up to this point. The highly aesthetic bridge with flexible attachments is now ready for clinical placement. When the patient returns for the second visit, anesthesia is required. Create Class II preparations on the abutment teeth to receive the glass span rope. Try in the glass span bridge for proper fit and confirm the tooth preparation is adequate. Make adjustments as required. Be sure that the channels permit the glass span to fit below the occlusal surfaces of the abutment teeth. Coat the flexible glass span attachments of the bridge with clear bond and porcelain veneer luting paste or a flowable hybrid composite resin. The internal surfaces of the preparation are etched with phosphoric acid for 15 to 20 seconds and thoroughly flushed with water. After placement of a universal dental adhesive, the internal surfaces of the channel are coated with a thin layer of clear, unfilled resin and polymerized with a curing light. Place a layer of posterior composite onto the floor of the preparations and seat the bridge into place. Again, be sure to position the glass span attachments below the occlusal surfaces of the abutment teeth so as not to expose the glass span during final finishing and polishing. After properly positioning the bridge, light cure. Completely cover the glass span attachments and incrementally fill the preparations with posterior composite resin, curing each layer with the polymerization light. Check the occlusion and adjust if necessary. Conventional fluted carbides, interproximal carvers, and polishing agents are used to open embrasures, provide acceptable contours, and impart a final surface luster to the restoration. The glass span bridge offers your patients a highly aesthetic, less expensive alternative to traditional tooth replacement. Traditionally, teeth such as these that are mobile due to injury have been stabilized using metal ligating wire and composite resin. The glass span emergency trauma splint is a simple, less time-consuming alternative. Begin by etching the surfaces of the teeth to receive the splint with phosphoric acid for 15 to 20 seconds. Flush thoroughly with water. Place clear, unfilled resin on the etched surfaces. Systematically cure with the polymerization light. Measure to determine the amount of small glass span rope required for the splint and cut to the proper length with the end binders having been removed. For this technique, it is not necessary to place clear bond on the glass span prior to cutting. Instead, insert the needle tip of the flowable hybrid composite resin tube about 2 to 3 millimeters into the hollow end of the small glass span rope. Inject the composite into the glass span until it is extruded from the other end. This ensures complete wetting of the ceramic fibers internally. Also, coat the external surface of glass span with the flowable composite. Do not polymerize with the curing light at this time. Place a layer of flowable hybrid composite onto the teeth. Position the resin-coated glass span on the labial surfaces of the teeth to be splinted. Systematically cure each tooth with the polymerization light. Place a second layer of flowable hybrid composite over the glass span rope to completely cover the material. Notice how gentle this technique is to these injured teeth, causing no additional trauma during the splinting process. Again, systematically light cure each tooth. This easily fabricated splint provides immediate comfort and relief to the patient, who will be able to eat normally during the healing process.
Thank you for watching the video. I hope you've enjoyed watching this video as much as we've enjoyed making it. As you can see, we're quite excited about this product, and there's no question about it. It's a product for now, and certainly a product for the future. As the new century rolls in, new techniques in dentistry will be coming along. This is a product that will help bring along the new century of dentistry and the new and different ways of doing things. Remember, we at Glassband are committed to quality in dentistry, quality fiber reinforcement systems in dentistry, and we're always available, myself, my staff, to answer any of the questions that you may have about the Glassband technique. Don't hesitate to give us a call at our toll-free number, and we'll do whatever we can to help you be successful using the Glassband system in your practice.